Number 7. Increased access to telemedicine through novel practice and policy changes.
It is a new spin on the old-fashioned house call. Using technology, although easy and effective, movement to virtual visits has been slow. COVID-19 restrictions changed that pace, forcing clinicians to conduct many of their appointments online. The need was immediate, but risks like data breaches and limits on Medicare coverage slowed expanding access. On March 6th, Congress passed the Coronavirus Preparedness and Response Supplemental Appropriations Act, allowing healthcare professionals to bill Medicare for telehealth during the public emergency. Since then, federal agencies have taken unprecedented action to expand access, issuing emergency directives to grow the types of telehealth providers covered, as well as increase connectivity in rural areas. In April, data showed 90% of physicians were using some form of telehealth, well above the rates seen prior to the pandemic. Leveraging this momentum, there are opportunities for long-term adoption to permanently improve patient experience and access to care.
Hi, this is Dr. William Morris, and with me is Dr. Beri Ridgeway, Associate Chief of Staff, to talk about the top 7 medical innovation, distance health. So Dr. Ridgeway, tell us a little bit about how COVID shaped the use of telehealth.
COVID was a complete disruptor, and it was a disruptor that we needed. We'd been working really well with our telehealth efforts and really trying to meet the patient where she is or he is. And with COVID, people were fearful of coming in. We also had restriction of some services based on our concern for the pandemic and government restrictions on in-person visits. Fortunately, based on the work that we'd already done, we could quickly pivot to a very high proportion of care that was performed via telehealth. So we really used this disruptor to our advantage, already just on the shoulders of the work we had done, and we're able to really continue caring for all of our patients via virtual visits.
Access is so important for patients continuing, whether it be chronic disease management or certainly an acute illness. How does policy play a role?
Policy is so critical, and I believe it was one of the barriers that prevented us from really taking telehealth to the next level prior to COVID. Fortunately, in early March, the government, both federal and at the state level, made significant changes in policy that really allowed us to catapult our efforts in telehealth and be there for our patients. This included who could see patients, what type of provider, what platform, meaning that we could use the telephone, we could use simple video chat functions within our phone, which previously were not allowed, and also coverage, insurance coverage, both at the government level and at the private level. We're now covering these types of visits, which is really how it should have been all along.
So lastly, this is certainly the new normal. Do you imagine us going back?
I don't think we're going to go back to where we were, which was a very, very small percentage of our total care. We really have pivoted in a major way. We are not doing as much telehealth as we did during the height of COVID and our concerns, but we're still significantly being able to reach patients across state lines, patients who can't come in, and really being able to be there for our patients where they need to be seen. We're in a stage right now where we're seeing how this will all settle out and developing best practices, both on the outpatient side, but also on the inpatient. Really thinking what we can do in inpatient where we can provide our world-class care anywhere in the globe for inpatients who need that type of care.
Thank you, Dr. Ridgeway, for sharing your perspective. And we look forward to see how telehealth and distance health transforms the way we manage our patients.